Hello friends, how are you? Assalamu alaikum. I hope you're well. You are on my channel and its name is Find Your Mind. My dear friends, as you know that I am discussing different personality disorders nowadays. So I have described about paranoid personality disorder earlier. I tried to give all the details related to that disorder. Now today I'm going to discuss about obsessive compulsive personality disorder. Dear friends, this disorder is very common nowadays. Therefore, I think this topic is very important. Although all topics are important, but I think this disorder related to the personality, like this is obsessive compulsive personality disorder, it should be discussed in detail. So, first of all, I'll discuss the diagnostic criteria. Then I'll go to the diagnostic features, its associated features and its prevalence, its cultural related diagnostic issues, gender related diagnostic issues, and definitely the differential diagnosis also. So first of all, I'll go with the diagnostic criteria because it is very important for a disorder to discuss the diagnostic criteria. Without the diagnostic criteria, it is not possible for us to distinguish between the disorders. So friends, here we go, and the diagnostic criteria for the obsessive compulsive personality disorder is: it is a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control, at the expense of flexibility, openness, and efficiency, beginning by early adulthood and present in a variety of contexts, as indicated by four of the given, such as number 1, it is preoccupied with details, rules, lists, order, organization, or schedules to the extent that the major point of the activity is lost. Number 2, shows perfectionism that interferes with task completion. Number 3, is excessively devoted to work and productivity to the exclusion of leisure activities and friendship. Number 4, in overconsciousness and inflexible about matters of morality, ethics, or values. It is not accounted for by cultural or religious identification. Number 5, it is unable to discard worn out or worthless objects, even when they have no sentimental value. Number 6, it is reluctant to delegate tasks or to work with others unless they submit or exactly his or her way of doing things. Number 7, adopts a spending style towards both self and others. Money is viewed as something to be hoarded for future catastrophe. Number 8, shows rigidity and stubbornness. Now I'm gonna move towards the diagnostic features of the obsessive compulsive personality disorder, and it says that the essential feature of obsessive compulsive personality disorder is a preoccupation with orderliness, perfectionism, and mental and interpersonal control, at the expense of flexibility, openness, and efficiency. This pattern begins by early adulthood and is present in a variety of contexts. This is the thing which I have described in diagnostic criteria. Now it is again in the diagnostic feature of the obsessive compulsive personality disorder. Now, individuals with obsessive compulsive personality disorder attempt to maintain a sense of control through painstaking attention to rules, trivial details, procedures, list, schedule, or form, to the extent that the major point of activity is lost. This is also what is the criteria number 1. They are excessively careful and prone to repetition. paying extraordinary attention to detail, and people tend to become very annoyed at the delays and inconveniences that result from this behavior. For example, when such individuals misplace a list of things to be done, they will spend an inordinate amount of time looking for the list rather than spending a few moments recreating it from memory and proceeding to accomplish the task. Time is poorly allocated, and the most important tasks are left to the last moment. The perfectionism and self-imposed high standards of performance cause significant dysfunction and distress in these individuals. They may become so involved in making every detail of a project absolutely perfect that the project is never finished. For example, the completion of a written report is delayed by numerous time-consuming rewrites that all come up short of perfection. Deadlines are missed, and aspects of the individual's life that are not the current focus of activity may fall into disarray. Individuals with obsessive compulsive personality disorder display excessive devotion to work and productivity to the exclusion of leisure activities and friendship. This is the criteria number 3. This behavior is not accounted for by economic necessity. They often feel that they do not have time to take an evening or a weekend day off to go on an outing or to just relax. They may keep postponing a pleasurable activity, such as a vacation, so that it may never occur. When they do take time for leisure activities or vacations, they are very uncomfortable. And if they spend time with friends, it is likely to be in some kind of formally organized activity, such as sports. Hobbies or recreational activities are approached as perfect performance. These individuals turn play into a structured task. Now coming towards the criteria number 4, and they may force themselves and others to follow rigid moral principles and very strict standards of performance. They may also be self-critical about their own mistakes. Individuals with this disorder are rigidly deferential to authority and rules and mistakes. They insist on quite literal compliance with no rule bending. Now, criteria number 5 says, often these individuals will admit to being tech rats. They regard discarding objects as wasteful because they never know when you might need something and will become upset if someone tries to get rid of the things they have saved. Their spouses or roommates may complain about the amount of space taken up by old cars, magazines, broken appliances, and so on. Criteria number 6 says that they are stubborn and unreasonably insist that everything be done their way and that people conform to their way of doing things. They often give very detailed instructions about how things should be done. Individuals with this disorder may be miserly and stingy and maintain a standard of living far below what they can afford, believing that spending must be tightly controlled to provide for future catastrophes. They are totally wrapped up in their own perspective. They have difficulty acknowledging the viewpoints of others. Friends and colleagues may become frustrated by their constant rigidity. Even when individuals with obsessive compulsive personality disorder recognize that it may be in their interest to compromise, they may stubbornly refuse to do so, arguing that it is the principle of the thing. Now there are the associated features supporting diagnosis of this disorder, and it says that when rules and established procedures do not dictate the correct answer, decision making may become a time-consuming, often painful process. Individuals with Obsessive compulsive personality disorder may have such difficulty deciding which tasks take priority or what is the best way of doing some particular task, and they may never get started on anything. They are prone to become upset or angry in situations in which they are not able to maintain control of their physical or interpersonal environment. Although the anger is typically not expressed directly. For example, an individual may be angry when service in a restaurant is poor, but instead of complaining to the management, the individual ruminates about how much to leave as a tip. On other occasions, anger may be expressed with righteous indignation over the seemingly minor matter. Individuals with this disorder may be especially attentive to their relative status in dominant-submission relationships and may display excessive deference to an authority they respect and excessive resistance to authority they do not respect. Individuals with anxiety disorders, including generalized anxiety disorder, social anxiety disorder, which is social phobia, and specific phobias, and obsessive compulsive disorder, which is commonly known as OCD, have an increased likelihood of having a personality disturbance that meets criteria for obsessive compulsive personality disorder. Even so, it appears that the majority of individuals with OCD do not have a pattern of behavior that meets criteria for this personality disorder. Many of the features of obsessive-compulsive personality disorder overlap with type A personality characteristics. Now, what is the prevalence of this disorder? Obsessive-compulsive personality disorder is one of the most prevalent personality disorders in the general population, as I have told you earlier, with estimated prevalence ranging from 2.1% to 7.9%. So there is also a culture-related diagnostic issues about this disorder, and these are: in assessing an individual for obsessive-compulsive personality disorder, the clinician should not include those behaviors that reflect habits, customs, or interpersonal styles that are culturally sanctioned by the individual's reference group. Certain cultures place substantial emphasis on work and productivity. The resulting behaviors in members of those societies need not to be considered indications of obsessive-compulsive personality disorder. Gender-related diagnostic issues. In systematic studies, obsessive-compulsive personality disorder appears to be diagnosed about twice as often among males. And now, the last one is the differential diagnosis. Obsessive-compulsive disorder. Despite the similarity in names, OCD is usually easily distinguished from obsessive-compulsive personality disorder by the presence of true obsessions and compulsions in OCD. When criteria for both obsessive-compulsive personality disorder and OCD are met, both diagnoses should be recorded. Hoarding disorder. A diagnosis of hoarding disorder should be considered especially when hoarding is extreme, such as accumulated stacks of worthless objects present a fire hazard and make it difficult for others to walk through the house. When criteria for both obsessive-compulsive personality disorder and hoarding disorder are met, both diagnoses should be recorded. Other personality disorders and personality traits. Other personality disorders may be confused with obsessive-compulsive personality disorder because they have certain features in common. It is, therefore, important to distinguish among these disorders based on differences in their characteristic features. However, if an individual has personality features that meet criteria for one or more personality disorders in addition to obsessive compulsive personality disorder, all can be diagnosed. Individuals with narcissistic personality disorder may also profess a commitment to perfectionism and believe that others cannot do things as well. But these individuals are more likely to believe that they have achieved perfection. Whereas those with obsessive compulsive personality disorder are usually self-critical. Individuals with narcissistic or antisocial personality disorder lack generosity but will indulge themselves, whereas those with obsessive compulsive personality disorder adopt a miserly spending style towards both self and others. Both schizoid or schizoid personality disorder and obsessive compulsive personality disorder may be characterized by an apparent formality and social detachment. In obsessive compulsive personality disorder, this stems from discomfort with emotions and excessive devotion to work. Whereas in schizoid personality disorder, there is a fundamental lack of capacity for intimacy. Substance use disorders. Obsessive compulsive personality disorder must also be distinguished from symptoms that may develop in association with persistent substance use. So we have learned that the person with obsessive compulsive personality disorder is very stubborn and has OCD type thoughts, but these are also critical about themselves. So my dear friend, this was all about the personality disorder, and I have discussed the second personality disorder now. So I'll come soon with a third one, and I'll decide which one is this. You can also comment me that which one should be the next personality disorder which I have to discuss with you. Now please take care of yourselves and the people related to you. Thank you so much. Allah Hafiz.